Highly contagious strains of the coronavirus are spreading across this country. The CDC has recorded nearly 1,000 cases of the three variants, first reported in Britain, Brazil, and South Africa, across 35 states. And now we're getting new insights into how the virus mutates from a team of doctors who studied one extraordinary case. Extraordinary is the word here. Carter Evans is following the story. Carter, good morning. We've never heard anything like this.
Gayle, good morning. This is the story of a 45-year-old man in Boston who had a COVID-19 variant for 5 months before he died. Now, during that time, his doctors found the virus inside of him had mutated, get this, more than 20 times. Now, this is an extraordinary case, considering the life cycle of the virus in a healthy person is typically only around 2 weeks. Now, the reason why it lasted so long is because the man was immunocompromised, like an estimated 10 million other Americans. But in this case, the man's immune response wasn't strong enough to fully eradicate the virus. It was just strong enough that it forced the virus to adapt and essentially mutate. Now, the doctors who treated him published a report on this in November, but the story's now getting renewed attention with the emergence of variants like the one from South Africa and the one in the UK. We spoke with one of these doctors. His name is Jonathan Lee. He says this case is shedding light on how the virus adapts.
I think this particular case is, in retrospect, a harbinger of what was to come. And I think that it just goes to show that we need to do a better job of monitoring the spread of these variants, and that only by looking for these variants will we be able to detect it. And that it's something that I think we haven't done as well up to now.
Carter, you know, this disease, this virus continues to baffle, surprise, and scare. We're hearing a lot about those variants from South Africa and the UK. But in the last few weeks, cases in this country seem to have been steadily declining. So do you think the variants could change that?
Well, Dr. Anthony Fauci's really been warning about this. He's saying there's evidence that people who've recovered from the coronavirus can get reinfected with these variants. And that's why there's more urgency than ever to speed up our vaccine rollout, so more people have some measure of protection and the virus will have less of an opportunity to mutate. It's also going to give vaccine developers time to work on boosters to better protect against mutations. But the key, Gayle, is going to be doing the genetic testing to detect these mutations when they get out into the wild.
Yeah, still so much to learn. Thank you, Carter.